I'm Eleanor Rothwell. I work for Sustrans as a Mentro Allan coordinator for Rhondda Cynon Taf. Mentro Allan is a project that was trying to get more people involved in doing physical activity in the outdoors. One of the main successes of the project has been the partnership working with many different organisations, but in particular the mental health services in Rhondda Cynon Taf. With this DVD we're hoping to demonstrate the impact that this partnership working has had on the lives of the people involved, as well as how the service providers view the project and the benefits they've had out of it for their services. The film begins with Nicholas Sweet, who works for Rhondda Cynon Taf County Borough Council. You'll see her talking about the positive impacts it's had for her service.
As I managed our direct services and being part of the steering group, I could see the need to give it a fair chance. To do that, we'd have to allocate a specific worker to each of the 3 geographical areas. We were fortunate that there were enough volunteers in each area to make it happen. Sometimes the managers found it difficult to prioritise, especially when there's absences and other calls to cover. But I think in terms of giving the pilot his fair chance, we needed to make that commitment. Our service users joined with other local mental health groups and members of the public, and it all took off from there. The real opportunity to join a community-based group. There's no stigma attached, everybody joins on an equal basis, make new friends, meet new people, just feel they've got something to look forward to. Well, the walking group, for example, the photographs of people up the mountain in the rain looking so cheerful says it all, you know. From a service user's point of view, their real benefits of taking part. If you look at outcomes for them, they're the things that win people over. They can see how somebody's developed. One of the examples I can think of was the lady who had issues with dirt and she used to have to wash a lot. And then to see her splashing in puddles, it's amazing.
It's nice and enjoyable, like to meet new people, because until like I started doing a walking group, I wouldn't go out much. We were over in Penarth, and for 5 years I was just in the house. I didn't go out at all. I just sat in my room, watched telly.
I never thought a couple of years ago with my aches and pains and that I'd be going out walking around lakes and looking at ducks and things like that. But the group as a whole has encouraged us to come the next week. So you don't put yourself off then, you're asked this week, are you coming next week as you leave the walk? And then you've got something to look forward to. We've proven that we can do it. We're not all seized up.
People worry the government is going to stop their benefits. At the end of the day, we're doing this once a week. It's therapeutic. That's what puts people off these organisations and walks, is the government keeps saying, well, if you can do this, if you can do that, you're capable of work. Well, because psychological illnesses as well.
I started the walking group because it seems to help my mental health a bit more by getting me out and about. Well, it focuses my mind on other things. Well, I've started a course to lead the walk. I found it very interesting. We're thinking of doing it now starting from June. I've done first aid and mental health first aid. So if anything was to happen, I'd be aware of what to do.
It is nice because you're not pushed out somebody that is willing to fall back with you and walk with you, take, you know, at your own pace. Last week is the first week, so I knew it would be hard because I'm very inactive, very unfit, but I feel a difference within a week.
A lot of our clients, when they come to us, are isolated, suffering from anxiety, a great fear of interacting in groups. I thought the variety of the leisure opportunities on offer was fantastic. It was pitched perfectly for our client group. It was very flexible, and it's really job satisfying to see some people basically turn their life around through regular periods of exercise and activity, and the social aspect, meeting and keeping new friends. Basically, it's an excellent project.
It keeps you outside the flat for a day, and the longer you're outside the flat, the better. Whatever sort of exercise you do, a little is a lot better than nothing. Obviously, the more exercise you do, the more weight you're going to lose, especially if you're on a diet as well.
I enjoy the activities days because the more exercise I do, the happier I feel, and there's beautiful scenery, especially on the walks. As the activities go, I feel that working as a group is a good thing for mental health and getting to know other people.
I think the staff certainly enjoy it. We have a regular member of staff who facilitates the group, and if ever he's off, then it's not generally difficult to get the member of staff to cover the group, which suggests that people enjoy it, myself included, because we've had family members who've come together, so that's benefited the carer as well as the service user. Some medications that are prescribed to our service users, one of the side effects is weight gain or increased appetite. So it is a huge issue for people, you know, their weight and body image. So it goes some ways towards addressing that in a nice, gentle fashion. And I would think from Mentro Allan coming into being was to address health issues in this area. And because of the low-key element, you're not asking a lot of people, asking them to come and meet and go for a short walk.
I enjoy going on the walks. They're very good. They get me out of the house, get me to socialise more, and that's all positive when it comes to the mental illness that I've got. Helps me realise what normality is a bit more, which is my problem. I don't have a firm grasp of reality. Getting out, meeting people, all good stuff. Beats the mad rush of the psychiatric hospital when you're living in each other's people's shoes, really.
Mental health will always be there, but when I get something to do, some goal, every day is a good day.
Of course, when Gary joined, I was still working, and then he was saying about it, and we both like walking anyway. So I said, well, can I come along? And he said, well, yes, because it's an open group.
We've been walking, and fresh air, exercise, it's lovely.
I enjoy talking more than the walking. I'm a sociable person. When it comes to places like this, you're free to talk about anything you want to. In the drop-in, they're all in a group, so you can't really go off and talk to someone and then go and talk to someone else because they're all squashed together sort of thing. And if I was stuck in the house, I'd start thinking of things and I'd get depressed. I start thinking about my friends and they all got jobs and girlfriends, babies.
It's great to have somebody who knows what they're doing, walking around and knowing the area and can point out places and things of interest, because I don't drive. That's the enjoyment, and meeting new people as well, and the exercise, because the secret of keeping moving is keeping moving. I make scrapbooks of all our walks with my photographs, and I make notes of what I see and where we've been, so that when I look back in years to come I can say, I remember that walk and I remember we did this and we did that.
Well, I was apprehensive at first, didn't know what to expect, but I just love it. I tell everybody about it. Any colleagues who were wanting to get somebody they're working with out and about, I say, tell them about the walking group. And I reel off the places we go, you know, and how laid back it is and friendly it is. I can think of one person who initially, when we met up at the bus station, wouldn't tend to gather with the group. She would be standing away from them. She's really benefiting from the socialisation and the interacting with people.
That children expect to achieve. We were now dealing with people who had a very low self-esteem. They didn't expect to achieve. And when they did achieve, it was like somebody switching the light on. They've been vulnerable most of their lives, and their parents are naturally very protective. And they may not have allowed them to have a bike in case they had an accident. And now you're saying to them, yeah, you can ride a bike. And they're saying, can I? And then we're saying, yeah, you can ride a bike. And then they're saying, I can ride a bike. So, you know, it's making up for that time. And it's a pity, really. It can't go on.
Mentro Allan really has opened the doors, opened it to other people which we wouldn't have known about.
And they didn't know about us.
No.
Through the increase of the service users participating, that it's been beneficial for them and it's helped us because it's keeping them well. they're not in need of our services as much because they're going elsewhere as well. And a few of them now have taken the walk leaders course, but then we have to look at their mental health and know that when they're on down days they aren't going to be able to lead walks and things like that. So sometimes there is need for a professional to be there to give them the encouragement to carry on.
Well, it seems to keep my head clear. I seem to be more happier when I'm outdoors walking to being in the house all the time. It seems prettier like getting on with people because they seem to know me and I know them. And in a group it seems to be much more safer because people out there looking out for you. I seem to be much fitter, yeah. I seem to lost a stone in weight. I seem to got more confidence to go mountain biking on my own and walking my dog, things like that.
If you consider we work in a fairly deprived area, it is about getting people to participate in quite easy activities that will actually challenge them. The physical fitness aspect then, the guys have reported marked weight loss. They feel better and a feeling of well-being mentally. If we have a healthier patient group or service user group, the cost benefits to that then for the group will mean decrease in hospital admissions.
Yesterday there was one lady who I picked up in the morning and made a big effort to get up out of bed to come to our Women's Day, and she hadn't ridden a bike for about 20 years. She actually went on a cycle with the group and she came back and she was ecstatic because she had ridden a bike. She'd had fresh air, it was a beautiful summer's day and she was buzzing. When I took her home then, she was constantly talking about how good she felt and how she was looking forward to going cycling again. And it was just really good as a staff member to see someone who in the morning was very lethargic, very quiet, going home a different person, all because she'd done cycling.
How I got involved was seeing all the advertising for Mentro Allan. I went mountain biking 1 week, didn't like it very much, fell off about 6 times. I go every Friday now, out in the fresh air, otherwise I wouldn't have the opportunity. Steve is biking instructor, very outgoing, come on, get involved, let's go, very encouraging.
Unfortunately, a lot of people, their workload is such that they can't take an afternoon out, which is a real shame because I think it's good for the staff as well. Rather than being sat in front of a computer, you know, this is different to what we do. We can see what goes on, we can see the benefit. A lot of the service users won't want to go to a specifically mental health group because they feel they're being labelled. Likewise, outsiders won't come into that. And this is ticking all the boxes. It's getting people out, it's giving them support, makes them feel good about themselves. It's a very thriving group. And it's a living thing, it's constantly evolving and changing to meet the needs of the people.